When cells of the body that are meant to do something change the course and start multiplying abnormally, that is called cancer. Cancer is abnormal growth of your body cells, and if this happens, if you can discover it early enough, it helps you to go on your treatment such that you can be fine. But if you cannot discover it early enough, this could be really difficult for individuals who are suffering from cancer. Hello everyone, thank you so much for tuning in on this episode of our. Thank you so much for joining this live discussion. Let us begin this live show in the name of the Almighty, most merciful, most glorious. May the peace of the Almighty be with you. May the peace of the Almighty guide you. May the peace of the Almighty protect you. May the peace of the Almighty have mercy upon you and myself and everyone else. Thank you so much for tuning in on this discussion. We are going to look at breast cancer symptoms, as well as we'll talk about cancer in general and talk about other type of cancers as well. So if you're just joining, please don't forget to give us a comment. Let us know what you think about the topic, and if you have any question, you put in the comment section, as well as you also share this video to your other platforms. Thank you so much. I'm your host, Tima Dawood, a medical laboratory scientist at Tima Diagnostic Center and a reproductive health consultant. Thank you so much for tuning in. Breast cancer is actually the most commonly diagnosed cancer around the world, which therefore means that if you want to diagnose cancer, you see that breast cancer will go at the top. But since we have symptoms for cancer in general and breast cancer in particular, if you have an idea about the symptoms and you know how you can navigate and know that this is a symptom of breast cancer, so that you stay away from it and you take the steps to avoid devastating effect of cancer. So we are going to go through some of the symptoms here, and if your symptom is not among that is a symptom that you think that it should be added, if you don't have it among here, please feel free to put it in the comment section. Thank you so much. The very first symptom we are going to look at is a thickened area of your breast. A thickened area of your breast is our symptom of breast cancer we are going to discuss about. Now, you need to first of all understand that one of the best ways you can know if there is an issue with your breast is doing your monthly self-breast examination. So your monthly self-exam will help you, your monthly breast exam, and you do this at home, it will help guide you to know if there is an issue with your breast or not. You need to understand that with monthly self-exam, when you do it every month, it guides you towards understanding these symptoms we are going to be talking about. These symptoms we are going to be talking about here will be practically difficult for you to understand if there is an issue with your breast without doing the monthly self-exam. So I implore you, I encourage everyone watching this video that please make sure you do your monthly self-breast exam. Do your monthly exam so that you know what is right or what is wrong with your breast. Talking about the symptoms which we are going to be discussing, and the first symptom being a thickened area of your breast, you cannot understand if part of your breast is thickened or not if you don't do your monthly self-exam, unless you maybe visit your doctor for your doctor to examine your breast for you. But it is important that you do this monthly breast examination, self-breast examination, so that you understand what is normal or what is not normal. You need to also understand that monthly self-breast examination actually helps you to know the normal breast and the abnormal breast. Without understanding your monthly self breast examination, it will be difficult for you to know if anything is going wrong with your breast. Please, I encourage you, if you menstruate for 3 days, 4 days, immediately after your menses, please do this self breast examination. Stand in front of your mirror, observe your breast, know which one is normal, know which one is abnormal. By the time you already understand that your breast, this is how it looks like, this is how it looks like, it becomes much more easier for you to know which one has a problem when there is a problem. But if you don't do this monthly self breast examination, it will be difficult for you to know it. So I encourage you, please go home and make sure that you do your monthly self breast examination. Go home and do it. Do it. If you menstruate for three days, do it on day 4 of your cycle. If you menstruate for 4 days, do it on day 5 on your cycle. If you menstruate for 5 days, do it on day 6 of your cycle. If you menstruate for 6 days, do it on day 7. If you menstruate for 2 days, do it on day 3 of your cycle. Now, I'm avoiding your menstruation. If you're menstruating, please, it will be good that you wait for the menstruation to stop, because during menstruation, hormones are acting on your body and you might be misleading yourself. Maybe you are thinking, oh, come on, there's something wrong with us. There is nothing to menstruation. So it is important that you do it at least just a day after your menses has stopped. So this will guide you to know if there is something wrong or not. Now let's go to the explanation. Now, a thickened area of your breast. So a thickened area of your breast could indicate that leading towards breast cancer. But you should not just feel this and you start concluding yourself. It ever means that if you do your monthly self breast examination and you realize that there is a thickened area of your breast, what do you need to do? Please, you visit your doctor, talk with your doctor, and your doctor should be the one to tell you that, hey, this means nothing or this means something. And if your doctor tells you that, then you go ahead and you follow exactly the instructions from your doctor. But doing your monthly self breast examination, it guides you towards understanding whether you have a thickened area of your breast or not. The second point is a sunken or an inverted nipple. A sunken or an inverted nipple is a second symptom of your breast. Generally, during your self-breast examination, you need to be looking at your nipples as well. You look at your breast, into breast. So if you have a sunken nipple or an inverted nipple, then it should be a cause for concern. You talk with your doctor and you visit him or her. The next point is a dimple. A dimple, right? When you have your skin getting inside. So when you have your skin getting inside, so if it's part of your breast, you see it like falling inside, then it should be a cause for concern. You talk with your doctor for it to be checked if there is something wrong. Please, all of this will be made easier if you do your monthly self-breast examination. If you don't do your self-breast examination, forget. It therefore means you only need to visit your doctor for your doctor to tell you that or not. The next is nipple changes or a scar. So if you have nipple changes, then you should also visit your doctor. Nipple changes here, it might be reddish, it might be increase in size. Any changes that you have been looking before and you see that no, this is a change which is not normal. This is not how my nipple used to look like. This is not how my nipple used to look like. Then you talk with your doctor so that this can be fixed, this can be attended to, and it's something that in special care your doctor will tell you. The next is a heart lump or heart lump on your breast. Please, if you're a lady, please, among the symptoms of breast cancer, a heart lump around your breast is the most important symptom. Please do your monthly self-exam in order to understand that if you have heart lump around your breast, you need to visit your doctor immediately, because this is very, very interesting as related to breast cancer. Thank you so much for being here. Please, we are going to continue with part 2 of this, to continue to talk about breast cancer symptoms. If you have any questions, put in the comment section, and don't forget to follow us on Twitter, Instagram, and Facebook. We are Check Your Health and Maintain Your Health. Thank you so much. May God bless you. Have a wonderful evening.